Hello everyone, Dr. Chris Martenson here. Is science really driving health policy in the United States and Europe, or is it politics? Sadly, I think it's politics at this point in time. We're going to look at that. We're going to look at Fauci's recent testimony in front of the Senate, and we're going to take a look at some exciting new data around herd immunity. I think we might be there in some places. Come join me. But before we begin, first a correction. Last time I made a mistake and I showed that Australia's ICU bed capacity was only at 0.8%. That was an error. Thank you to everybody who found that and pointed that out. Let's take a quick peek. As you can see here, what I did was I accidentally added, let me get my drawing tool out over here, because what I did was I accidentally added all of the things together. So this is all of Australia, 10, which consists of 8 plus 2. What did I do? I made that into a 20. That was totally wrong. When we correct that, what do we get? Here's the corrected version. 10 divided by 2,350 ICU beds means that Australia's actual bed capacity is at 0.4%. So let's just go ahead and we're going to correct that. So I'm so sorry about that mistake. 0.4%. There. That looks better now. I think we got that all done. All right, so let's go moving on right now. Before I begin, I have to tell you something. Really, it's very, very important. I know those of you who've listened to me for a while understand this, but maybe there's some new listeners here. I don't do left-right politics. I'm really a very apolitical person. What I do and I care about is up-down, integrity. I care about science, and everything I'm going to tell you today is in defense of science, logic, common sense, or as we might say, uncommon sense, because it seems uncommon these days. So that's what I really care about here. If you think you hear me making political statements supporting one side or the other, you're mishearing me, or I'm misspeaking in some way. I don't mean to convey that tone. Everything we're about to talk about is in defense of science, logic, and common sense. All right? So with that, why don't we get started here? And the first thing I want to do is I want to talk about this testimony that Anthony Fauci gave. He's the director of the NIAID, that he gave in front of the Senate recently. This is an exchange between Senator Rand Paul and Fauci. We're going to take it apart piece by piece because I think there's something really instructive in here. So let's see if we can start with this right now, and we're going to bring this up.
Do you have any second thoughts about your mitigation recommendations, considering the evidence that despite all of the things we've done in the U.S., our death rate is essentially worse than Sweden, equivalent to the less developed world that is unable to do any of the things that you've been promoting? Do you have any second thoughts? Are you willing to look at the data that countries that did very little actually have a lower death rate than the United States?
You know, Senator, I'd be happy at a different time to sit down and go over detail. You've said a lot of different things. You've compared us to Sweden, and there are a lot of differences. And you said, well, you know, there are a lot of differences between Sweden, but compare Sweden's death rate to other comparable Scandinavian countries. It's worse. So I don't think it's appropriate to compare Sweden with us.
Not appropriate to compare Sweden with us, suggesting that there's something really desperately different between cultures. So you just can't do that. You just can't do that. But is that the case? Is that really a scientifically valid statement right there, or is that something else? So first, let's turn here. Let's note that Sweden is actually number 12 in the world deaths per million list. Not a great place to be, but let's see who's higher than Sweden on this list. Oh, I think we notice here that the United States is absolutely on this list as well. And hanging out here at number 1, 2, 3, 4, 12, 11, 10. So number 9 on the list is the United States with 624.68 deaths per million people. And the UK there at 631.7, with Sweden way down here at 577. So that's actually a fairly significant difference. And who's doing better in the United States? Well, this list goes out to 54 countries at this point in time. So basically everybody who's from number 10 on down through 54 is doing better than the United States. Would it be inappropriate to compare the United States to all those countries, or just some of them? Or why is it inappropriate to compare the United States to Sweden? That's a legit scientific question. Who should we compare the United States to, and under what circumstances? Why are there differences? Who's done things differently, and all of that? So there are a lot of countries doing way better than the United States who are very, very far down on the first world, second world, third world list, who have resources that are a skinny, bare fraction of what the United States could bring to bear. So I don't know that it's totally something we can dismiss right out of hand and say that the United States can't really be compared to Sweden. I don't know about that. So let's note that when we turn to Sweden's actual cases here, we do see that Sweden is, in fact, we're seeing new cases. Remember, this is cases as measured by in positive infections. So a case to me is somebody who shows up in the hospital, needs hospitalization. That's a case. Otherwise, this is an infection. So Sweden's infections are indeed climbing, but when we look at Sweden's death counts here, we see that they are just an absolute flat line. So this is actually a pretty valid thing to say, hey, Sweden did a completely different thing than we did. They didn't shut down their economy. They had a very different approach to everything, very much more relaxed. And this is Sweden's experience with it right now. So Rand Paul was basically saying, is there anything here we can compare? And is there anything valid in that? And first thing up is Fauci pretty much just rejected that right out of hand. So said, nah, there's really nothing here that you just can't compare Sweden to the United States. And by the way, to stack those two graphs up so we can see them on top of each other, again, this is new cases, but really infections in Sweden as compared to daily new deaths in Sweden, and you see how they stack up on top of each other. Reason being, some of you are probably thinking, hey, cases or infections precede deaths. But here we can see that their secondary infections started to wave up in early August. And so that's August, September. We're 8 weeks into this. Their deaths, if they were going to follow, really ought to have followed along. So this is speaking again to the idea that what we're calling new cases is really testing. We're seeing testing. Some of this is false positives, some of it's real positives, but what we're not seeing is the same experience that we saw in that first wave of infections, which led to so many deaths. A lot of reasons that could be. Better treatments, but also maybe that the cases or infections that were being detected in the first wave was a skinny fraction of the total amount that actually could have been detected there. So is it totally inappropriate to ask questions around Sweden? No. But we're going to expand this. I'm going to show you data from a lot of other countries that says it's a completely valid way to look at this. But first, let's go on. This is the next bit of testimony. I'll rewind it a tiny bit so you can orient. I'm not doing any cutting, pasting here. We're just taking Fauci's entire testimony from beginning to end in 5 different pieces. So this is piece number 2. Let's check in.
It's worse. So I don't think it's appropriate to compare Sweden with us. Yes, we have, I think in the beginning, we've done things based on the knowledge we had at the time. And hopefully, and I am, and my colleagues are humble enough and modest enough to realize that as new data comes, you make different recommendations. But I don't regret saying that the only way we could have really stopped the explosion of infection was by essentially, I want to say shutting down. I mean, essentially having the physical separation and the kinds of recommendations that we've made.
Okay, so this is an interesting argument he's making. He's basically saying no regrets. We did everything we could. All the progress we made is due to the fact that we made these recommendations to shut the economy down, physical distancing, masks, hand washing, all of that stuff, right? So no regrets, did what we could. The data supports that we did the best we could at the time. Now, I will tell you that at the time that he's talking about, back in March and April and May, I was giving advice that talked about things like vitamin D, hydroxychloroquine, ivermectin, the Math Plus protocol. There were lots of different protocols we could have run back then that we weren't running that are now slowly sneaking in. But to suggest here we did everything we could with the best data we had at the time is not true. And we can go back into my own video record and the video record of Dr. John Campbell and Dr. Seholt and all these other people who also were saying the same sorts of things. And we don't have $32 billion budgets, none of the people I just mentioned. So what I would like to suggest here is that this isn't actually a scientifically valid statement here. This is not a correct historical record to say we did the best we could with all the data we had at hand, when in fact, I had better data apparently than he did with their multi-billion-dollar budget. And so I want to turn now to this really interesting study that came out here. And this one is, let me see if I can pull this down a little bit so I can get more. Yeah. All right. So this is, I think, a great personal risk is how I'm titling this one. And the reason is that let's take a look at what we're seeing here. So this is evolution of COVID-19 cases in selected low and middle income countries. Are they past the herd immunity peak? Look at this. We have somebody here from harvard.edu, but noting that these authors did this work in their personal capacities. So they're not willing to take the risk of, or Harvard wasn't willing to take the risk of saying, yeah, we'll put our name to that. These are people who do have pretty prominent positions, but they've said, we're doing this on our own time. Kind of like I had to do this stuff on my own time and at my own risk as well. It's now politically dangerous to attach your research, even if it's perfectly valid research, if the outcomes of that research don't point in a way that certain political aims want to achieve at this point in time. That's the sad nature of the times that we actually live in right now. So let's look now at this study. Really fascinating. I can't wait to go into this with you here. They say, we've studied the evolution of COVID-19 in 12 low and middle income countries in which reported cases have peaked and declined rapidly in the past 2 to 3 months. Now, we've been presenting this with the XYZ herd immunity hypothesis, which says, hey, kind of independent of a country's social status, resource status, medical care, approach to running the NPIs like masks, like social distancing, et cetera, that they all have this sort of same pattern that they're following, where you get a big peak up and then a rapid peak down. All right, so they noted the same thing here. They say in most of these countries, the declines happened while control measures were consistent or even relaxing and without signs of significant increases in cases that might indicate second waves. So they didn't do anything different or they were even relaxing what they were doing. And despite that, whether they were keeping their efforts constant or even relaxing them, they were seeing these same declines happening. We'll show you the data in just a second. For the 12 countries we studied, the hypothesis that these countries have reached herd immunity warrants serious consideration. And it does. This is what science does. We look at all the hypotheses out there. We start gathering data from the real world, and either your hypothesis is informed and strengthened or it's refuted. So they're saying, hey, the data kind of fits with this idea that maybe we've got herd immunity. And it's worth exploring because if you can get to herd immunity, that's the gold standard here, right? That's all a vaccine even does for you, is it gets you to herd immunity just with a vaccine intervention. They're saying maybe countries got there in a native and a natural way. All right, so let me just skip past some of the statistics here and how they did this stuff. What's interesting here is they found that the effective basic reproduction number, or the R0, that then turns into an R at some time T, the basic reproduction number of SARS-CoV-2 ranged between 1.5 and 2.0, a little bit lower than what we were looking at as some of the possible ranges, but still much, much higher than influenza. So something with an R0 or a basic reproduction number of 2.0 is going to rip through your population really quickly unless you have strict containment measures around that. So this indicates that the curve was flattened in some countries but not suppressed by pushing the reproduction number below 1. So any efforts countries were making might have pushed or shaped the curve a little bit, but it didn't flatten it below 1, which is actually what I think has happened in a number of countries such as New Zealand, South Korea, et cetera. There's ways to both contain, really crush that number and suppress that number, or there's ways to actually just sort of live with it and it's going along. You've flattened it a little bit, but you haven't made it below the 1 number. And by the way, in our reproduction number of 1 means that on average, if one person who's infected, say I'm infected, I will on average pass that to one other person before the infection passes from my body. So obviously if we get that below 1 and I infect 0.8 people and then that 0.8 person infects 0.8 people, statistically, the disease goes away. All right. The results suggest that between 51 and 80% of the population in these countries have been infected. 51 and 80%. 80% were totally in the threshold for herd immunity there. And that between 0.05% and 2.5% of cases have been detected. So very few cases have actually been detected in this story. Values which are consistent with findings from serological and T-cell immunity studies. The infection rates combined with data and estimates for deaths from COVID-19 allow us to estimate overall infection fatality rates for 3 of the countries. Overall IFRs, infection fatality rates, not case fatality rates. Big number here to get right. The values are lower than expected from reported infection fatality rates by age, fascinating, based on data from several high-income countries and the country's populations by age. COVID-19 may have a lower mortality risk in these 3 countries to differing degrees in each country than in high-income countries due to differences in immune response, prior exposure to coronaviruses, disease characteristics, or other factors. So what they're finding here is that the herd immunity hypothesis would not have fit really well with the evolution of the reported cases, they're saying here, in several European countries, even just after the initial peaks, they say here. So their hypothesis is that they looked at 12 countries, they studied them, and they say that they've reached herd immunity. And they should now be tested further. They're calling for more studies, put some serological tests, T-cell immunity studies, all that. But they think, based on their data, that herd immunity has been achieved. So let's look at that data now. Here are 6 of those countries from this study. This is fascinating. Afghanistan, Bolivia, the Central African Republic, Colombia, Egypt, Ethiopia. The shape of the curves is the same in each one of these countries. And obviously, Afghanistan is a very different culture from Ethiopia, which is different from Colombia, which is different from the Central African Republic. But despite that, look at the similarity in each one of these curves. And the way you get a curve like this, and they said, again, you get these curves independent of when they tightened up their restrictions, when they loosened them, what sorts of restrictions they were running. It was independent of that. Each of these countries is their own beast, and they had their own responses. And despite that, you see these very similar curves. In fact, here's 6 more countries: Kenya, Madagascar, Malawi, Namibia, Pakistan, South Africa. Look at the stunning similarity in all of these particular charts right here. Every one of these has basically the same shape. And so the idea is that given that these countries are all running different sorts of programs, the best explanation, the best hypothesis you could do to fit to this data would be that there's herd immunity actually running and afoot. And so their basic conclusion sums up in this figure here, where they basically said, look, if you're just running, letting the herd immunity sort of come through, you would get this typical red curve right here. The timing and width of the peak is kind of uncertain. But if you push on that and you flatten the curve a little bit, you get the R0 still higher than 1, but less than it was. You get this curve sort of spread out a little bit. That's the only difference between the red and the green. The red, it just spikes through your population. You did nothing. The green is, well, we tried some things. We wore some masks. People caught on. They had some social distancing. That happened. And then the green came out, but it's just spread the curve a little bit. What's interesting is they say if you had a really aggressive social distancing and program, you did lockdowns, then you get the blue curve where you really smash this thing down, but then a little bit later, you get a second blob of these things, of infections coming along. Why? Because you got to get to herd immunity one way or the other. So by really suppressing the overall outbreak of this, all you've done is pushed it out to later. Now, I'm not saying that's a bad thing. That's actually a good thing. I was very much in support of pushing that curve out. Why? Because what were we doing in March? We were throwing people on ventilators, and they had a 50 to 80% death rate. We didn't know about some of the frontline treatments we have now. We needed science. We needed medicine to be able to catch up with this new disease that we are facing, right? And because of that, again, I think it was totally appropriate to flatten the curve and push things out as far to the right as possible. But the experience of these countries says, over here, which I got to get my mouse to come back, says, hey, there's a first wave and maybe that's it. Maybe, you're kind of done and then you have immunity. Again, this doesn't suggest, let me be clear, this doesn't suggest that we won't see a case where, because it's a coronavirus, people are going to have their initial immunity and that will wear off, and that maybe we see this thing come around year after year or every 6 months or whatever the cadence is between people catching that first wave, proportion of them losing their immunity to that over time, and then catching it again. And again, we don't have a lot of data to say whether that second time is going to be worse or easier than the first time. All of that, I get that. But this is really presenting a strong case that herd immunity has been achieved in these very disparate and mostly poor countries. These are all countries that have, we might call them third world, right? And by the way, turns out might be being in the third world was actually an advantage in this story. And let's get to talking about why that is. Here, we're going to see Dr. Fauci actually doing something that's a big no-no in my world, which is confusing correlation with causation. Let's listen into this part again. This is the third clip and from that one series.
Recommendations that we've made.
You've been a big fan of Cuomo and the shutdown in New York. You've lauded New York for their policy. New York had the highest death rate in the world. How could we possibly be jumping up and down and saying, oh, Governor Cuomo did a great job? He had the worst death rate in the world.
No, you misconstrued that, Senator, and you've done that repetitively in the past. They got hit very badly. They've made some mistakes. Right now, if you look at what's going on right now, the things that are going on in New York to get their test positivity 1% or less is because they are looking at the guidelines that we have put together from the task force of the 4 or 5 things of masks, social distancing, outdoors more than indoors, avoiding crowds, and washing hands.
Okay. So you heard what he just said there. He said, no, you've misconstrued the data. He didn't misconstrue the data. New York has one of the worst death rates in the world. That's true. As well to say, but hey, hold on. New York is now testing under 1%. And that's because they're following our 5 guidelines here, right? So that's all social distancing, mask wearing, hand washing, stuff like that. Okay. So is that true or is that not true? Well, that should be something that we would find in the data pretty quickly because different states had different responses to this. So if we can't compare ourselves to Sweden, Dr. Fauci, maybe we can compare ourselves to other states. Well, let's go there. We had a very interesting post put up by user Base12 that came up on my website at Peak Prosperity. There's the link to it down below. Oh, and by the way, the links to everything. If you see a link here, of course, it's contained in the video description that accompanies every one of these videos. I put all of my research out there. You can click every link, find out, is this true? Is this not true? Do you see a different interpretation? That's what science is about. I throw it all out there. So this is a link to, you see down below. And here's what Base 12 did that I found really particularly interesting. It was this. And I love this approach. Well done, Base 12. So he wrote in this comment, he said, there's been a lot in the media about Sweden's approach to COVID. There has been very little, if any, coverage of a group of states here in the United States that followed much of the same approach. These states, Iowa, Utah, Nebraska, Wyoming, North Dakota, and South Dakota, aka the Sweden states, never imposed lockdowns and don't have statewide mask mandates. So that might compare them to some of those third world countries we saw before as well. Many, but not all, imposed restrictions on certain businesses, though. These were short-lived and imposed later than in other states. All the states are currently in WalletHub's top 10 for fewest restrictions, except for a few instances. The states have been pretty consistently in the top 10 of the ones with fewest restrictions since May 1st. Okay, so these are states, they didn't follow all that NIH stuff. They didn't do what New York did. They didn't do a lot of lockdowns. So what's their experience? It's a good question. So what did Base 12 do? He downloaded data from the CDC's website on September 21st and have spent free time since then to compare these states to the rest of the country. The results were surprising. Keep in mind that the decision to impose lockdowns was done 6 months ago, before 98% of COVID cases occurred. Good point. So it couldn't be a case of selection bias. Good point. Same with mask mandates. It has been months since these were implemented in most states. Plenty of time for the no mandate states to catch up to their masked counterparts. So here's the argument. Looking at 3 things here: COVID, excess deaths per million in population, looking at non-COVID excess deaths per million, and then looking at the total of excess deaths per million. Really important to do this. And here's what he found. So in states that have no lockdown and no statewide mask mandate. So this is the Sweden states. Their COVID deaths, excess deaths per million, clocked in at 240 per million. The rest of the country, let's see here. What's that? That's 573. That's more than twice. How about non-COVID excess deaths? So this is important because total excess deaths is really what we're looking at here, because a lockdown does a couple things. It both it keeps people from dying from all sorts of things, car accidents, falling off of subway platforms, heart attacks because they're jogging, or whatever the story is. And as well as people who are dying because they couldn't get to the hospital, they're dying from things because COVID imposed the lockdown. So it's a plus and a minus. So you want to know, where are we on that line, above or below? And it turns out that the non-COVID excess deaths per million declined by 105 per million in the so-called Sweden states, but were plus 110 in the rest of the country. So you add all that up, what do you get? Fascinating. Total excess deaths per million, 135 in the no lockdown, no statewide mask mandate states, and 683 for the rest of the country. So that's a really fascinating sort of a result there. And it's really important, I think, to look at things this way. So fascinating. What is the actual conclusion here? So Base 12 said the rest of the country is more than double the number of COVID deaths per million people versus the Sweden states. Also, all 6 Sweden states are now below the national average. And it turns out that the Sweden states also have negative 105 non-COVID excess deaths per million. And in comparison, the rest of the country has 110 excess deaths per million population, in addition to their COVID deaths. So weren't the lockdowns supposed to reduce those non-COVID deaths? The numbers suggest the opposite. So this would say, hey, this is kind of cool. We should dig into this. It's kind of interesting data. So if you compare total excess mortality, which is really the best comparison, right? And it is, because as I mentioned, there's pluses and minuses. Since there is no way to hide behind a lack of testing, for example, the numbers are even more skewed. The rest of the country has 5 times more excess deaths than the Sweden states. That is fascinating. I then thought, hey, maybe it's a regional thing, so I compared the Sweden states to all the states touching them that had lockdowns and mask mandates. The numbers were closer, but the Sweden states still came out on top. Neighboring states have 1.6 times the number of COVID deaths and 3.7 times the excess mortality of the Sweden states. That's good research right there. You say, hey, I found this finding compared to everything, but let's compare it to all the states surrounding these 6 states. And that's how you do things like this. So there's a finding here. Do we have an answer for why that finding is? Do we have all the data? No. But this is very suggestive and is very interesting. And this is the kind of thing that Fauci should be really on top of. This is the kind of thing you would think his team and his staff are poring over on a daily basis, because we're just trying to answer the question, what works, what doesn't work? Whole new thing. Let's find out what works. That's science. That's inquiry. That would be the appropriate way to go about this. So in fact, of the 14 states compared to the 6 Sweden states and 8 neighbors, the 5 worst states have excess mortality, all have mask mandates and have locked down. So think back to that thing we just showed where Fauci says, hey, we did everything we could, and New York is now in the bottom 1% of all states because of all this great stuff we recommended. Maybe New York has already hit herd immunity. It's a possibility. We'll get to that in just a second. Or maybe there are other states that have done even better for reasons that we ought to be curious about, because, hey, that's what science is. We're curious, right? The Sweden states also have much lower unemployment rates than the rest of the country. And so that factors into the death rate, because one of the key indicators of suicide in people is a lack of economic opportunity. So for people who are lost their jobs, slipped, out of relevance in the economic cycle, much higher chance of statistically of committing suicide. So it'd be interested to look at that data as well. The number 1 and 2 states and 4 of the 6 lowest states, 4 of the 6 lowest for unemployment are Sweden states. The other 2 are ranked 12th and 19th. All interesting data to me anyway, especially the totally excess mortality. I completely agree. So well done, Base 12. Nicely done. As well, in that last clip, we saw that Fauci said, hey, we follow the data and we do the best we can. And when the data changes, we think we're humble enough to follow along with that. Remember, I've been talking for a long time here about vitamin D. So let's take a peek at this. If Fauci's NIH and the NIAID, if they follow the science, then why is vitamin D not one of the 5 things? Why aren't there 6 things that he's recommending? Masks, distancing, hand washing, and vitamin D, right? Because this, we've known about this for a while. Look at this, correcting Britain's vitamin D deficiency could save thousands of lives. It's an article that just came out. I realize it came out a day after his testimony, but the data is much older than that. This is data I've been presenting for months, right? This reads here, in May, arguments on the link between vitamin D deficiency and its association with poor COVID outcomes started to gather pace. So that was in May. September. That month, the health secretary's attention was drawn to 2 studies in May showing a strong association between the incidence and severity of COVID-19 with vitamin D deficiencies in the patients. Vadim Beckham of Northwestern University, one of the authors of one of those studies, said about healthy levels of vitamin D that our analysis shows it might be as high as cutting the mortality in half. In May. So I have to ask this question at this point in time. So as of September 29th, 2020, as I'm recording this, the NIH, the NIAID are still not recommending that people take vitamin D. It's beyond inexcusable at this point in time. I thought this was about health. I thought this was about the right things. Something that cuts mortality in half. How are we not trumpeting that across the airwaves at every possible moment? By the way, the risk of taking vitamin D is almost zero. It's just a supplement. You can take it, you can buy it over the counter, you can gobble it. There's no warnings that say don't take this in case blah, blah, blah. We all need it. And really, everybody ought to be taking that as well. But think, too, about the basic premise of a lockdown. Stay inside, don't come outside. In Australia, we presented last time that in Victoria, they're saying you got to stay inside except for 1 hour of exercise outside per day. That is exactly the wrong advice you would give, because where do we get vitamin D naturally? From the sun. And so really the advice ought to be skins versus shirt pickup basketball game. We want to play skins in this game. Take your shirts off, everybody, and get out in the sun and get lots of vitamin D. And if you can't do that, and maybe you're confined to an old folks home and you're bedridden or something like that, or you're in prison, I don't know, take vitamin D as a supplement, right? That would be the other opportunity here. But at any rate, absolutely, for Fauci to say we follow the science and we're humble enough to do that is absolute BS, because we should have. There's no excuse for the vitamin D angle not being trumpeted. Look at that. Our analysis shows it might be as high as cutting the mortality rate in half. How is that not a thing here at this point in time? All right. Let us, sorry about that. My phone was ringing. All right, let's continue on here, and let's go to the 4th clip here, because we got 5 in total, so we're almost through it.
Avoiding crowds and washing hands.
Or they've developed enough community immunity
Right.
that they're no longer having the pandemic because they have enough immunity in New York City to actually stop.
I challenge that, Senator, because I want to, please, sir, I would like to be able to do this, because this happens with Senator Rand all the time. You were not listening to what the director of the CDC said, that in New York, it's about 22%. If you believe 22% is herd immunity, I believe you're alone in that.
Boom, look at him sit back. Ooh, boom, he just dropped the mic on that whole thing, right? That's amazing. So he's saying 2 things here. 22% refers to the seropositivity rate in New York City for people who have antibodies in their serum. You take the blood out and you look for antibodies against SARS-CoV-2. 22% was the peak rate. Hey, I've got the data right here. Let's take a quick peek at it. Here it is. So we see that New York peaked out at about 22% here in detectable antibodies in circulating bloods of people walking around. Okay, everybody, look at everybody else. 5%, 6% seropositivity in other places, right? So boom, he's like, yeah, that's not a thing. And he's very sure about that. But how about the data? How about the data that says New York still has a few cases coming on, but their death rate has flatlined out to pretty much 0? And we have all these other countries here, 6 of those 12 that I presented from before. So the question before us now is, how do you explain this if not by herd immunity? At least an open question ought to be, Senator, that's an interesting point of view. I don't hold it right now, and here's why. But he just doesn't have time. He just doesn't have time to educate that ignorant senator on this whole thing. And by the way, I'm one of the people who thinks that 22% seropositivity is when you've achieved herd immunity or something close to it. I've presented this XYZ hypothesis on herd immunity. It posits X, Y, and Z as separate variables. X% of the population has pre-existing immunity for some reason, probably due to prior exposure to other common cold viruses, coronaviruses. Y% get exposed, don't get antibodies, but still fight this thing off. Kids are like this, right? So it's probably T cell immunity. And then Z% do develop traditional B cell antibodies, but it's a fraction. 22% might be the fraction that says enough people have been exposed that we get this herd immunity thing. And I just presented that paper that showed those 12 countries that have what looks like herd immunity. None of them had extensive, abilities to really fight this thing. It sort of came and washed through their population. There they are. And then there are your social behavior changes, and those do add to this whole thing. If you have a society that's wearing masks, is socially distancing, is not shaking hands and then rubbing their noses, you have a much better chance of herd immunity threshold comes down because of that. So that's X plus Y plus Z plus the social behavior changes, SBC. Those four things together give you your herd immunity. Fauci is suggesting that you only get herd immunity because you have circulating antibodies. And by the way, that's the vaccine response. We give vaccines to develop B-cell antibody responses in people, and because people have the antibodies, we can now say they are immune to this thing, and that's the only facet that they're looking at. But we now know that immunity is a big, wide range of things. It includes traditional B-cell immunity as a wedge of the pie, which includes T-cell immunity, and it's a pretty wide wedge that we know now, especially for coronaviruses. It includes as well the terrain of your body and how well your body is actually tuned to fight off a disease, including things like having adequate vitamin D levels in there, having plenty of sleep, low stress, all of that. And then finally, it includes the idea that we make changes in our behavior once we understand germ theory, and that helps to lower that threshold. Fauci knows all that, but he came out and just like, boom, you don't understand this stuff, Senator. It's only antibodies. I don't know anybody who thinks 22% is, there's not one other person who thinks 22% is herd immunity. I do, because I understand this hypothesis, and it makes a lot of sense. By the way, he goes further than that. Let's tune in for the last clip here, because this is really kind of stunning to me as a scientist. Here it is.
I believe you're alone in that.
There's also the pre-existing immunity of those who have cross-reactivity, which is about a third of the public in many estimates from studies, which would actually get you to about two-thirds.
I'd like to talk to you about that also, because there was a study that recently came out that pre-existing immunity to coronaviruses that are common cold do not cross-react with the COVID-19.
Thank you, Senator Paul. Senator
Boom! Look at him. He is a smug, satisfied man right there. He is just, I just laid down the law, the science, the long arm of the scientific law got laid down on Senator Paul here. There's just a problem with that idea that there is no cross-reactivity with the common cold. I know I've heard this somewhere before. It was probably a fringe science group. Who did that? Oh, yeah, I remember. It was the NIAID. Immune cells for common cold may recognize SARS-CoV-2. This is from August right here. This is Fauci's own organization. Let's check in with the conclusion from this paper. Says we have now proven that in some people, pre-existing T-cell memory against common cold coronaviruses can cross-recognize SARS-CoV-2 down to the exact molecular structures. Proven common cold molecular structures in some people. This could help explain why some people show milder symptoms of disease while others get severely sick. Oh, so there is that. Gosh, yeah. What did Fauci say here again? Because this is kind of interesting to me. Let's listen in.
About that also, because there was a study that recently came out that pre-existing immunity to coronaviruses that are common cold do not cross-react with the COVID-19.
Thank you, Senator.
Oh, wait, I got to see the smug part.
Senator Paul. Senator
Ooh, got it.
I believe you're...
Actually, that's not the case, because there is this. And, of course, there's also this, selective and cross-reactive SARS-CoV-2 T-cell epitopes in unexposed humans. So there's that, too. There's those two papers. There's this one, too. There's this one, too. Targets of T-cell responses to SARS-CoV-2 coronavirus in humans with COVID-19 disease and unexposed individuals. There's a lot of data. The T cell thing there's tons of data. And the studies have been done. We've read them. We've presented them here before. It's a thing. Did you see how Fauci just flat out just said, and by the way, I'm going to have to play this now because I'm trying to keep up with what Fauci's saying. Remember, he's Mr. Mask, no mask. We don't know, don't take vitamin D. I am, and then all this T cell stuff is just crazy. It's just, I don't know. It's just, this is my brain trying to make sense of what Fauci's telling me from a scientific standpoint. I just, give it up. What a fighter. All right. I needed that little humor break. Sorry. Thank you for indulging me. All right. This is where we get to the politics over science part, and thank you, Claire Wilson, for writing this up in September 1st. What are T cells and why have they become a political football? We just watched political football. We did not just watch science, however. And when politics comes before health, when politics comes before science, you get bad outcomes. That's what we're up to right now. That whole piece of exchange by Fauci, maybe he was having a bad day, he was just feeling cranky. I don't know what was going on. But what we watched was a very smug bureaucrat delivering non-scientific answers that, frankly, are embarrassing compared to what the actual science is right now. So that's me as a scientist, not left-right. I'm not here to support Rand Paul. I'm not here to take Fauci down for any political reasons. I'm here to tell you that some legit questions were asked and really poor answers were given. And that, unfortunately, means that our response here in the United States to SARS-CoV-2 and COVID-19 is no different than what this cat just did. It's a mess. Remember, the common sense approach. This doesn't have to... This doesn't have to be that hard, okay? Everybody prepares their terrain by taking vitamin D, getting plenty of rest, eating well, sleeping, being stress-free as much as possible. Wear the mask in public. You want that low inoculum, of course. People like that. The low inoculum is really important. And people take extra precautions who need to. The aged, the infirm, the people with comorbidities, all that. If you have an exposure and it's caught early, you take HCQ plus and or ivermectin. By the way, I've got super explosive, amazing, awesome new study results coming in for ivermectin. That's going to be next time on this program. Be sure to check that out. And by the way, some people are going to progress further anyway. We're learning about their interleukin-1 response. Maybe they have antibodies against IL-1, and that's bad, and all that. If you have that, then you suppress the immune system so it doesn't fight itself so badly. That's where the MATH plus protocol comes in. Methylprednisone and heparin, those two pieces right there are the M and the H. A is ascorbic acid and all that. So there's a great protocol. It seems to work really well. But that's only if things actually progress, which they don't seem to when you take these other medications. All right. And then maybe a vaccine comes along and maybe we get to better herd immunity because a vaccine comes along. But my goodness, we don't have to wait for that at this point in time. Remember, we can explain a lot of what happens in and around COVID-19 because you have a perfect dead linear risk, which says that as you get older, your chance of dying from this increases exponentially. What this doesn't talk about is all the people who are long-haul COVID illness people who are getting sick and then really getting kind of damaged by it. I still would rather avoid this disease as much as possible, but I'm not as afraid of it as I used to be. Why? Because I changed my mind when new facts come along. Now that we know what we know about ivermectin plus, and the plus in this story is zinc plus tetracycline and or azithromycin, something like that. Now that we know what hydroxychloroquine can do, now that we know what having vitamin D in our bodies can do, I'm much less worried about it for myself personally because of this chart, because of all the other data that we've got going on. All right, our conclusions for today, which is September 29th, 2020, are... whoops, I have something in here that's not supposed to be here. No, let me get rid of that. This is from the last. Got it. All right, this is better. You ready? All right, Fauci is professing complete certainty on a lot of subjects, but he's really not basing it on science, not the science that we have access to. He's stating confidently that New York is now where it is in terms of its 1% testing positivity rate because it's following all the NIH guidelines, right? While many other places didn't do that, they're doing just as well or better. That means he's confusing correlation with causation, and that's bad science always, for sure. The NIH and NIAID still, CDC, still not advising people to take vitamin D. When it can cut the risk of mortality in half, why not? Why not? Do you have a good answer for that? Because I don't. Not a good answer. I got bad answers. I don't have any good answers for that. And Fauci is just coming off, he's just too dead certain about herd immunity. And that's running against both global observations, I presented that data today, and tons of T-cell science that suggests herd immunity is going to be a little bit more complicated than just counting the number of people who have antibodies circulating in their plasma. But that's the answer you got to give if you're really interested in promoting a vaccine against all other things. But why are we so talking vaccine? Why not vitamin D? The vaccine, I should note, its threshold for success is going to be, does it confer a 50% benefit? Well, you know what already confers a 50% benefit? Having adequate circulating levels of vitamin D in your bloodstream. Why is that not? It already meets or exceeds potentially the standard that's being set for vaccines. It's cheap, it's effective, it could be distributed right now. Why not? I don't have a good answer for that either. I got bad answers. I don't have any good ones. Fauci right now is coming across as somebody who's way too interested in politics, is the polite way to put it. It might be money. I don't know what his game is, but it's not science. As a scientist, that offends me, and I'm not okay with it. He's giving non-scientific answers smugly, confidently, and people are lapping it up saying, oh, that's the person we need to follow. Not me. I am not following him. Taking my vitamin D. And by the way, I will not be following NIH guidelines, and I hope my doctor doesn't either if I do happen to come down with this. I will be trying all the things that we already know works, and I would be asking questions about what are other countries doing that's working so well for them. We're going to present more of that data next time. Whew, do I sound worked up? I am, because you know what? It didn't have to be this way, and it doesn't have to be this way, and it shouldn't be this way. That's my judgment. It's my opinion. It shouldn't be this way. We should be following the best science, wherever that leads, whether that skewers prized pharma profits, whether that makes somebody look bad from an ego standpoint because they said this, but now they got to change their mind. That's what we ought to be doing, following the science. That's what I'm doing here with you. I hope that doesn't get me in trouble today. It might with the algorithms that have decided that if I'm not supporting Fauci, if I'm not supporting current NIH guidelines to the T, if I'm daring to suggest that maybe we as actual, intelligent, alert, informed individuals can look at the data and come to our own conclusions that might be different from what some other people are coming to, that's not an okay thing. That means we really live in an era where there's thought police, thought crimes, there's right ways of thinking, wrong ways of thinking, and that's not how the world works. Science is about skewering sacred ox all the time. It's about having a pet theory or a hypothesis that then just goes up in flames because new data comes along. That's the world that I like to live in, is where your pet theories go up in flames. I'll tell you this, the older I get, the less I know for sure. So with that, thank you very much for listening. That's all I have for you for today. Remember, there's a lot of things coming, and these lockdowns are going to lead to some very bad outcomes. That's why, what do? My approach to all this is tend to beauty, tilt all your actions towards regeneration. I know this is sort of an uncommon point of view to be taking right now, but that's how I am. That's how I'm built. We're going to be talking about this as we go forward, all the things that make common sense, or unfortunately in this day and age, uncommon sense. That's what I want to be talking to you about and bringing to you over time, because there's a lot of things about where the world is going that you need to know about. So we'll be getting to those too. And it follows this exact same approach. We take the data, we look at it, we form a conclusion around it. The data changes, we change our conclusion. That's how we roll here. Thank you so much for listening. We'll see you next time. And be well, be healthy.
Hi folks, Adam Taggart here, Chris's fellow co-founder of peakprosperity.com. I'm here to tell you that this year, due to COVID, we're bringing our annual seminar digital for the first time ever. And the theme is going to be, how do we prosper in a post-coronavirus era? We're going to be tackling questions like, how can we protect our loved ones and our wealth? And is there a way to prosper through the coming disruption that COVID's unleashing? Because of this crazy time, Chris and I wanted to do something truly special for our followers, which is why we're bringing together more expert speakers for this seminar than we ever have before. And we're making it all available to you at a truly rock bottom price. We're going to have an amazing lineup of talent this year. We're going to have economic experts like Mike Maloney, former Fed advisor Danielle DiMartino Booth, technical analyst Sven Henrich, macro experts like Wolf Richter, John Rubino, Charles Hugh Smith. We're going to have energy experts like Richard Heinberg and Art Berman. We're going to have farming and environmental experts like Joel Salatin, America's Farmer, the folks at Singing Frog Farms, and many other experts in building resilience across your money, your health, your home, and your community. Now, the conference is going to take place the weekend of October 24th and 25th. It's going to be 2 days of packed presentations, panels, and live Q&A. But don't worry if you can't attend live or watch the entire live event. Everybody who registers is going to receive replay videos of all of the presentations, plus hours of additional bonus presentations that we just simply can't squeeze into a 2-day event, and trust me, we've tried. If you register now before September 30th, you're going to get all of this for the extremely low early bird price of $179. And if you happen to be a premium Peak Prosperity subscriber, you're going to get an additional 15% discount savings on top of that. To learn more, go visit peakprosperity.com/seminar2020. Chris and I hope to see you there in October.